Our next presenter is Dr. Karan SHAH. Dr. Karan ATULBHAI SHAH. He is from VADODARA, Gujarat. His clinic name is DYNAMIS Homeopathic Clinic, which is AKOTA, VADODARA. He have done PG from JAWAHARLAL NEHRU Homeopathic Medical College, and he'll be presenting the case of varicose ulcer. Welcome, Dr.
Warm
Karan.
greeting. Am I audible, ma'am?
Yes, yes, you are audible. And you can
Warm
start your presentation now.
Okay, ma'am. Warm greetings to all of you. So myself, Dr. Karan SHAH, and I am going to present a case of varicose ulcer. You can see here, there are two pictures. The one that is on the left side, that was taken just before the treatment, and the one that is after right side, that was taken just after the treatment. We can see a drastic change in both of them. So let's start with the case. A 60-year-old widow female residing in Vadodara came on 13th of October with a complaint of deep ulcer in left leg. Patient was having this ulcer since 9 months and was taking allopathic medicine but was not getting relief. So presenting complaints were location left leg, sensation burning pain, discharge of pus, deep ulcer, and the modalities that was aggravation by motion. You can see here the severity of the ulcer. There was a lot of discharge. The pain was very agonizing and was very severe. So ODP, patient was having a varicose veins of left leg since last 10 years, which was complicated further in the form of varicose ulcer. Among the past history, known case of varicose veins since 10 years, she had got typhoid and COVID-19 and no diabetes, no hypertension. Among the physical journals, appetite, thirst, desire, aversion were absolutely normal, but perspiration that was profuse on scalp +2, sleep, urine, stool were absolutely normal. So one of the most important aspect in this case, that was life space. So she was a girl born and brought up in financially well-stable family. She had studied till 12th standard and was academically very weak. During her school days, she fell in love with a boy with whom she married later on. Her husband died in 2017, and that's the point when her all complaints started. She narrated that her husband was very protective. She felt very secured with the company of her husband. Since then, she always seeks support, which she finally found in her daughters. She had two daughters, 27 and 24 years of age. She narrated that the support that she was getting from her husband, now she is getting in the same form from his daughter in terms of emotional as well as financial. She always keep on requesting her daughter to not get married, saying that if what will happen to me if you both will get married. One of the incident that she narrated, that once she was admitted to the hospital due to COVID, and at that time she told that it was very impossible to remain without my daughter. She even requested doctor that if they can allow any one of her daughter to remain with her. She's a very kind of fearful and anxious kind of patient. She had anxiety of everything, of her health, of her own daughters. She kept on anticipating all the time, all kind of fear of dark, fear of animal, of some bad incident. Another incident that she described, that she need to travel from India to Canada for some event. She was going to travel with one of her daughter, but unfortunately her daughter couldn't come with her due to some reason. At that time, traveling alone, that too from India to Canada, was very disturbing to her. She told, I don't have any support. I need someone to protect me. I am very insecure. She also narrated that she always lacked confidence. She told that she was not even able to attend her daughter's parents' meeting in the school. She was feeling very low confident and thus was unable to talk with her daughter's teacher. So the totality of symptoms was formed on the basis of Kent's evaluation method. So first there are mental generals, that is insecure feeling, want of support, want of confidence, cannot remain alone, desire company, loquacious, that was on observation, physical general, profuse perspiration on scalp, and particulars, that are ulcer, discharging pus, deep ulcer, varicose ulcer. So now these are repertorization sheet. The rubrics that were taken, that were mind, confidence, want of, mind, company, desire, mind, loquacity, mind, insecurity, extremities, ulcer, varicose, lower limb, extremities, ulcer, deep, skin, ulcer, discharging, suppurating pus. So Analysis. Now, in every case, we try to find anchors. What are anchors? Anchors are something very fixed. The anchors is a stable reference point in the case, a fact that is both characteristic and beyond doubt. An anchor must be such that it must be sure, short, present in the case. So what were the anchors present in this case? In this case, the anchors were need for security, lack of confidence, and want of support. So this must be present in our medicine. Okay. The overall issues of the patient were observed in medicine of column 2 of periodic table. So what are the issues of column 2? Lack of confidence, dependency, support, backing, incapacity, anchor, protection, shield, always needing somebody. So based on this, the prescription was given, that was calcarea carb 200, 2 doses per week. We find in the periodic table calcium present in the row 4 and column 2. We find the issues of column 2 present in the case. So based on this, calcarea carb 200 was given. Okay. Now, whenever we select a remedy, it should not be like that. It must be cover only the rubrics. It should be cover all the aspect of the patient. We see the repertory. The calcarea carb was coming on the 5th number. Okay. So calcarea carb was present in the repertory also. System kingdom miasm, that is it belongs to column 2. Materia medica, in also materia medica we see profuse perspiration on scalp, varicose ulcer. So the remedy must be that it should cover all the aspect of a patient and not a particular one from here to there. Sometimes you can go from sometimes we repertorize the case, and then if it are suiting the kingdom and miasm, that is a conventional method. And sometimes we feel the patient, we decide the miasm, we decide the kingdom, and then we see the repertory chart if the rubrics are covering the remedy. But in this case, both conventional as well as contemporary system, both were intermingling to the single remedy, that was the calcarea carb. So now the follow-up. So after 7 days, just after prescribing calcarea carb, just after 7 days, pain has reduced by 10 to 20%. Discharge of pus reduced. Size of the lesion was also reduced. So as the still present complaints were still present, I thought to repeat the same dose, same potential, same medicine. So after 2 weeks, that is 15 days, burning pain reduced by 30 to 40%. Discharge of pus reduced. Size of the lesion further reduced. So I again repeated the same medicine, same potency. Okay, so this is a picture taken after 1 month. Pain reduced by 50%, no discharge from the ulcer, and size of the ulcer was further reduced. Same medicine, same repetition. Okay, so this is a picture after 6 weeks. We can see the no pain at the site of ulcer. We can see here healthy granulation tissues developing. Headache which occurred sometimes on and off is not now occurring. So now I prescribe, I thought that there is no further medication required, so I prescribed placebo. That is after 10 weeks, ulcer is completely healed, healthy granulation tissue developed, no pain at the site of ulcer. Placebo was given. After 12 weeks, patient has no complaint now at all. Ulcer had completely healed. Now skin started appearing. Now she feels can perform certain tasks like traveling into bus or train alone. Patient was feeling complete sense of well-being. That is the most important thing for a homeopath. No medication was further required. So this is a gradual healing of the ulcer. The first one, that is on the first day when the patient appeared at the clinic, and we can see here gradually after 7 days, after 15 days, after 1 month, gradually the ulcer is healing. So this is a picture that was taken before, that is on 13 October, and this is 23/11. Total 40 days and medicine was given. So this is a perfect example that I can say of what homeopathy can offer in a pathological cases. Thank you, ma'am.
An excellent way of presentation as well. Thank you so much. So now let's go to the another presenter. Our next presenter is Dr. Priyanka Nasit. She is from Rajkot. She have done her PG scholars from college, Rajkot Homeopathic Medical College. She is practicing since 2 years, and she's practicing from her home only, which is there, situated in the Rajkot. I welcome Dr. Priyanka. Dr. Priyanka, you can share your screen and you can start the presentation. All the very best.
Okay. Okay. Good morning, everyone present over here. So I would like to share my screen.
Dr. Priyanka, there will be a small interruption while you'll be presenting. So we'll be joining back and you can continue after that.
Okay, ma'am. Sure.
Let's start.
Is my screen visible, ma'am?
Yes, it is visible.
Okay. So it is a case of hyperthyroidism. A female patient of age 47 years, she was a teacher by profession, came with the complaint of chronic hoarseness of voice since 2 years. And she is suffering from hyperthyroidism since past 9 to 10 years. And along with that, she told that she suffered from irritability on very small matters. She told that मैं easily गुस्सा हो जाती हूँ किसी पे भी उनकी एक छोटी सी बच्ची है 10 साल की उस पे भी वो गुस्सा कर देती है. नेक्स्ट इज अदर कंप्लेंट्स वाज ड्राइनेस ऑफ स्किन विथ फ्लेक्स. मतलब वो उसमें से स्किन में से वाइट कलर की पतली सी परत निकलती है उनके स्किन में से which was there even in summer and monsoon also. Pain in epigastrium on and off since many years with no aggravating factor. Other complaints was of headache which aggravates from noise and draft of wind. Her past history was tooth extraction in childhood due to tooth decay, and she was suffering from recurrent food and coryza during childhood, for which she had not taken any treatment, allopathic point of view, and she suffered from ASD, for which she operated at the age of 18 years. Her menstrual history was menarche appeared at the age of 14 years of age and menopause before 1 year, and she had no complaint during her menopause also. Her physical generals was appetite. She cannot tolerate hunger. She said that I have to eat something when I was hungry. I cannot remain hungry for a few while also. Thirst was scanty. Drinks only 2 to 3 glasses of water in a day, even in summer also. Sweat was profuse since 6 to 7 months. Earlier, her sweat was not much, but since 6 to 7 months, her sweat is profusely, even on slightest exertion. Urine frequently 8 to 9 times per day and 2 to 3 times at night. So it was more at night time. Sleep was sound, no disturbances. Stool was satisfactory and thermally she was chilly. So now analysis. Her mental gender was like her life space was like in childhood. She was very friendly and she was obstinate in childhood and very intelligent in studies. She took part in various activities, was very friendly, extrovert. But during her marriage time, it was like a trauma to the patient that no one was willing to marry her as she was suffering from ASD. So at that time, her younger sister was in a relationship with someone. So her sister was forcing her that you should marry now so that I can also get in a marriage relationship officially. So she was forced to marry a person which she was not like to marry him. So at that time also her this thyroid disorder developed at that time only, and she was continuously staying with this person, with this man whom she did not want to marry, and now he is torturing her very much, but she is still in a relationship with him because of her family members and because of her children. So I have taken rubrics like mind, undertaking things opposed to her intentions, and this was from childhood only. Anxiety about his children. She has one daughter for which she is very much anxious at what would become of him after my death. Worries constantly, fear disease impending of, and from Patak Materia Medica, I have taken angry, sensitive, irritable, easily offended, and miserable. This was taken from mind section from Patak Materia Medica, and it is given that she says and does strange things, and she was also very sad over her health and domestic affairs, constantly worries, frets and cries about her real or imaginary illness. So on this basis, I have prescribed Sepia 1M1 dose, and after 1 month in follow-up on 13th of June, her hoarseness of voice was decreased by 30 to 40%. The dryness of skin was gone completely better. The dream which was there of her daughter's anxiousness was also better, and the urination frequency was better by now she had to go at night only one time. Next follow-up was on 26th of July, and during that time, after 1 month, his voice was completely better, skin dryness better, sleep much sound than before, and in appetite, when she cannot tolerate anything during hunger, now she can tolerate hunger very easily and has no complaint of it during that. And urination frequency was better. On 5th of August, the skin itching was there, so on and off slightly, but not much. Sleep was sound, and her tension and stress which was much reduced and was feeling more energetic than before. So at that time also I prescribed Sepia 1M1 dose due to her skin itching recurrent was there, and then SL for 15 days. And she is still on my treatment, and she had taken carbimazole 5 mg 4 times a day, but now she is taking it for only but now she's taking only 2 times a day, morning and evening. So I conclude my session. Thank you very much, ma'am.
Thank you, Dr. Priyanka.